Hi, my name is Ryan O'Hare. I'm a PA in the Emergency Department at High Point Medical Center in High Point, North Carolina, and today I'll be talking about implementing a program entitled Decreasing Opioid Overdoses Through Education and Naloxone Administration in High Point, North Carolina. So the first question we have to ask ourselves is opioid overdose a problem? And the short answer is yes. Opioid prescriptions and rates in 2012 peaked at 255 million prescriptions. For every 100 people in the US, 81.3 opioid prescriptions were written. Between 1999 and 2017, there were 70,237 overdose deaths in the US. 67.8% of those involved opioids. In 2016 alone, 42,249 people died from opioid overdoses. The problem is also in High Point. The rate of opioid overdoses in High Point is higher compared to the state average. Opioid-related deaths in the state of North Carolina dropped by 5% from 2017 to 2018. In High Point, however, the rate of overdose deaths in 2019 is on pace to exceed 2018. From January to August of 2019, there were 16 opioid-related deaths in High Point compared to 17 in all of 2018 when the study was performed. The high level of opioid overdoses has not gone unnoticed in the U.S. or in High Point. The High Point Police Department offers and requires that all police officers carry naloxone while they're on duty, and they've administered it 20 times from January to August of 2019. And just to give a little bit of background, naloxone, or as you'll hear called Narcan, is an opioid antagonist that, when used, reverses opioid overdoses. So this program will work at the local level through tertiary prevention. The program's administrators will meet with local business owners to educate them on the prevalence of opioid overdoses in High Point, discuss the signs and symptoms of opioid overdose, explain how to administer naloxone, and provide the businesses and their owners with their naloxone medication to keep at their business and to use if needed. So who or what is the program targeting? Who are the program administrators? So the program administrators will first be led by the High Point Medical Center Emergency Department, which is the local hospital in High Point. The High Point University PA School, as well as the Wake Forest PA School, will be used to send their students out to provide these educational programs to the business leaders. The EMS service, as well as the High Point Police Department, will be partnered to see and to start to obtain preliminary data to see where the program is most needed within High Point and make it specific to High Point's needs. As well as we will partner with the Chamber of Commerce. The Chamber reported to me that the amount of businesses within High Point is around 800, and they have a lot of local meet and greets and different things. And so there'll be a prime opportunity for us to meet with them and partner with the Chamber of Commerce to get this word out and to connect with a lot of people very quickly. The targeted health concern that this program is looking at is opioid overdose, whereas the targeted population is the opioid overdose victims, specifically within High Point. Our mission statement, our objectives, our goals. The mission statement is to decrease opioid overdose rates through education and naloxone administration to local businesses in High Point. Our short-term goals are to increase awareness among local business leaders of opioid overdose by providing educational information and naloxone. Long-term goals are to decrease the rates of opioid overdoses at High Point. Our objectives are 50% of local businesses receive the educational seminars related to overdose signs and symptoms within 1 year of the program's administration and initiation. All local businesses receive naloxone administration packs within 1 year, as well as achieve a 20% decrease in overdose victims in High Point in the first 5 years of the program. So our determinants of health. So these things are the things that we want to focus on with our program. High Point has a unique economic environment due to its manufacturing industry. Biannually, High Point sees an influx of people from around the world for its furniture market, yet the poverty rate is 18.5% of its citizens. And of those 112,316 citizens, 30.1% obtain a bachelor's degree or higher, and 15% don't obtain any kind of high school degree. This is why this program is needed, and this is why we want to address the health literacy as well as poverty as its determinants of health. A study found that as poverty rates increase, so do prescription drug rates. The high poverty rate among the increased overdose, the high poverty rate along with the increased overdose rate proves that this program is needed. The program administrators hope that this program will have a ripple effect on the economy by implementing this program. The hope is that morbidity and mortality within the community decrease, thus improving the overall health of the community. And with the healthier community, there is a more robust workforce and thus a boost in the economy. When a community has lower educational levels, they live an unhealthier life. This program's administration hopes that by increasing the health literacy within the community, it improves the overall health and the well-being of its citizens. The biggest negative if we do not address these determinants is the worsening morbidity and mortality of the citizens. Those who have the potential to save lives do not have the skills or knowledge to address this issue. By not addressing the health literacy, those who have an those who observe an opioid overdose will not have the skills and those people will die. By allowing the morbidity and the mortality to be high due to this health issue, it puts a bigger strain on the economy and health resources within the community. So how will we retrieve our data? How will we design our research? The study will follow a quantitative research design with a one-group pre-test, post-test design. The program administrators will measure the changes in the opioid overdose before and after program intervention. Although if overdose rates do decline, the program cannot conclude that the intervention was the only reason for the decline. The program will be evaluated in a summative manner, and after 2 years, the program will assess how many businesses have access to the naloxone, as well as the educational part of the program, and how many medications have been dispensed. After 5 years, the change in overdose rates at High Point will be evaluated and observed. So how do we succeed? How do we improve the program? So the first thing is we have to have health communication and health education, and that comes with our educational seminars. We have to have interpersonal, organizational, and community channels. We have to work with these local businesses. We have to work with the Chamber of Commerce because that gets our word out quicker and more efficiently. We have to develop a SWOT analysis before we start to implement this program. We can identify the needs of the program, where the weaknesses are, and we can address those and fix those prior to even the program starting, which would help us. As well as to improve the program biannually, we will have meetings to address the concerns, the questions that people have, that local businesses have, as well as think of ways to reintroduce the program, make sure that we're meeting our goals, meeting our objectives, and our mission statement most importantly. So how are we outreach? So the first thing is social marketing. Word of mouth is a big thing, and a social marketing campaign used to influence the behavior by communication and delivering products. The program will use the 7 Ps to determine which marketing strategy is essential. I've chosen the product, the price, and the promotion as those most important Ps for this specific program. The product, obviously, the naloxone medication. If you don't have that medication, even if you can observe the signs and symptoms, you're not going to be able to save a life. The price will be free to all of its program participants. The promotion, once a life is saved, we want to be able to promote that. We want to be able to use social media and different tools to get the word out about this program and show people how it's needed and how it's working. As well as advocate for the program, we want to use knowledge as an advocacy tool, as well as media, knowledge coming from our PA students that we're going to be collaborating with to get the word out about the program, as well as the local media channels. So what's been done before? A study was using pharmacists as a way to get the word out and kind of do the same thing as this program, but in a lot shorter amount of time, and just basically gave out naloxone to medication to people in the community. And they did find a pretty significant amount of people that felt more comfortable using naloxone after the medication, but it was only done within a few months. And you can't really make correlations and causations because of a short amount of time. With my program, I want to do it over 5 years, see how much we can really impact and see a change. So our budget, so we will use our partners and our vendors to decrease the burden of the monetary funds, such as Walgreens locally within the High Point community to get the naloxone medication, as well as apply for an impact grant. As you can see on the right of the computer, there is a budget outline for what we will use, where the supplies will go, and where the money will go, and how much we will apply for through the AAPA impact grant. So the healthcare issue of opioid overdoses is one that has been widely discussed, thoroughly researched. With their increase in opioid prescriptions during the past few decades, the rate of opioid overdoses has increased. This increase has also been seen in High Point. In High Point, there's a need for this program to help decrease the number of people who die from opioid overdoses. Through this program, it aims to decrease the number of opioid overdoses, increase the health literacy, as well as increase the local economy of the community. So we'll work with local community organizations. We'll partner with them to achieve success. And we hope that one day that this will make a difference in someone's lives and hopefully save a life. Thank you for listening.